Oh yeah. That was beautiful.
I think you scared him.
I told my wife, I said, hey, watch, Dr. Mac gonna find something, watch. I promise you.
What did that feel like going?
It felt completely relief.
Clunk. That was awesome.
It was like, it just like, it's almost as if the vertebrae was stuck and you pushed it back into place. And the relief I felt was all the way up and down my spine.
Got you all loosened up, and now, see, head back for me. Head back. Try to put your head on the head. There you go. There you go. There you go. Head back for me. Much better. Head back. Exhale. Come on. Let it go. I got you. Wow. I'm sorry. That's tough. That's tough having it that tight for that long. It's okay. That's been
A
tough.
long time.
Yeah.
Is that your freaking elbow?
It's a thumb.
Your thumb? God, that's a really strong thumb.
Let it go. I got you. I think we got them all. Just checking. Wow.
Oh yeah, that was good. I've never had anybody crack me like that. I've never had anybody get big ones like that out of there.
Your spine has to know that I'm not gonna
Hurt it.
hurt it and step on your toes. I'm never gonna dance again.
My first significant back issue in the military was, you know those towers that you actually have to work with as a team to go up?
Anderson?
Well, I was actually helping one of my squad get up the tower, and one of the drill sergeants pulled me from the tower, and I around the tower were huge 2x4s and stuff to keep the wood chips and stuff in.
Yes.
And I hit my back. I remember hitting my back directly when I fell backwards.
How far do you think you fell?
I'll say a good 7 feet. When I hit the ground, it wasn't like a direct land on my back. I kind of hit the ground, braced my fall with my heel. But when I came back, the edge of but I was so angry. I got up, and it was not a pretty sight between me and him. So it was real early in my career.
So that was early 20s, let's say.
Yes.
Early 20s, you get pulled.
Correct.
Okay.
So as you know, in the military, you run, you ruck, you go to school, you do all these things, but you never really sit back and think about what's going on with your body. You're going out, you're partying, you're coming back, you're running 5 miles. Did all this stuff in Korea, all over the world, and when you're young, you just take a Motrin, get over it.
Right.
So after I retired in 2015, my body started speaking to me.
Okay.
And one appointment after I have never been to the hospital as much as I have in the last 9 years I retired. I have been to the hospital just about at least every year, at least 3 times. Okay. If it's not gastro issues, it's back problems, it's neck issues. The VA started giving me shots in my head because the tension in my neck was so bad, and that started making me get fat. So I was like, nah, I'm not doing that anymore. Yeah. And I ended up finding a couple healthcare providers with Orlando Health. Shout out to Orlando Health. Okay. They've gotten me to the point where it's manageable now. Okay. I've been seeing a chiropractor in Orlando. Shout out to Summit Chiropractic. Okay. They've been with me and my family for pretty much since I've retired. Okay. And they've got me to a point where I can maintain the pain. And then they recommend. I found Family Integrative. Mm-hmm. I've been with them for 4 or 5 years. They do acupuncture and everything. Their doctors are amazing, but they help me manage the pain and discomfort because I've been told I have a curve in my back, slight scoliosis. I've had 4 surgeries on this shoulder since 2006 from a combat injury. Rotator cuff replaced. I've had lower back surgery where they did a forenectomy and laminectomy, Orlando Health, of course, and gave me some relief on my one side. But now I have on my right side. Now on my left side, when I walk and everything, I get this pain that it never goes away.
Would you say the number one is the lower back the number one right now, or the neck? What would you say is the most?
The whole left side of my body. Just throw it away.
Side.
Just give me a new one. Just the whole left side.
Okay. All right. It's we have we mentioned scoliosis earlier, and when you have this level of pain, especially one-sided pain, it's very common that your body's going to try what we call functionally scoliotic, meaning
Right.
that your body tries to avoid and tilt and rotate to find relief. And so I would expect when you have that level of discomfort, especially the number of surgeries, your body's going to be rotating and twisting and trying to find something of comfort.
Right.
Like if you have something hot in your hands, you're going to move it around,
Exactly.
trying to. So typically, it's kind of backwards. The side that hurts actually is abused. It's functioning, but it's injured and it's done. And like you're saying, throw it away. It's already been cooked and has been beat up. But in terms of the members of your team, it's been your best member. It's the one that took you through all these years of combat and all the work that you were doing. And now it's saying it needs a vacation, it needs a break.
Right.
And I see a very repeatable story in almost every patient I've seen in 17 years, and since I was a kid. My dad's a chiropractor, and so we see patterns of abuse, meaning that the lower neck and lower back are predominantly almost where 99% of surgery occur, or at least that's where it's happening first. Not that the other areas can't get injured also, but they're the focus of surgery. And what isn't being talked about is the fact that all these other areas, something like 80% of the back, very rarely gets injured. And I find that to be the main way I can try to help you today. In like you're saying, I'm getting injections in my neck, and everybody's trying to focus on the injured areas, trying to de-inflame something that's injured. And I find that, like, if I get punched in the face, my face would swell up, and if I inject some anti-inflammatories into my face, but I keep getting punched in the face, it's not going to really work. You have to stop the punching. And they go, well, not sure if we believe in that. And I'm like, well, if you don't believe in not being punched in the face, I can't help you. You understand? There's no way, right?
Right, facts.
There's no way it's going to work,
Facts, right.
right? There's no way that you're going to stop. Well, it's damaged. I tore my labrum. Well, it got punched in the face a lot.
Yeah.
So, we can try to see if we can look at the posture and try to balance it, and we can try to divert pressure to other areas. And that's where if you had an MRI or something like that, I'm sure you've already, but I don't need to see it. But my point is that I guarantee you on every picture of your spine, there are areas that aren't injured, and that there are areas that are very injured. And the areas that aren't injured, why are they not injured? And they're not injured because they're probably not working. They're probably not mechanically showing up. And we don't feel the parts of our back that don't work,
Right.
because the sensors are all based on motion. So we only feel, it's killing me down here, it's killing me here, it's killing me here. Those are the parts where the sensors are going off because there's trauma and movement happening there.
Right.
And so our alignment, just like the tires in our car, if your alignment's off and then we get injured and then that makes our alignment worse and then we drive to California on a bad alignment, right?
Yeah.
Now we're going to have a really bad time with this car, right? So it's not, so young trauma, twist the alignment. Early 20s, you have this trauma, and the end result, I didn't feel too bad. I took some Motrin, I went away, it was no big deal. Yeah, it was a big deal because you healed, now crooked.
Right.
Right? I'm just making, you punched here, your body goes, okay, we're just gonna shift things over here now.
Precisely.
And so I'm gonna sleep on my left side now, whatever. And so I wasn't comfortable. After that fall, I wasn't comfortable laying on my right side. Yeah, it's because that made you confront the injury.
Because I realized that with this shoulder. This is my injured shoulder, but since I've retired, this shoulder on top just gives me this ache all the time. And this shoulder has never been injured.
Okay, yeah.
But so I actually see what you're saying.
And then it's even more complicated because the nerves from your spine will give you pain in the shoulder. And this is where it can get, doctors will start chasing the pain carrot, I call it, meaning that we try to zoom in on where the pain is. But we know with, say, sciatica, if somebody's hitting a nerve in their lower back, they can have pain in their knee or their foot,
Right.
and there's nothing wrong with their leg. It's all because there's a pressure on the nerve in the back. And in the same way, the nerves that leave our lower neck, a very predominantly injured area, where do they go?
Shoulder.
The shoulder and the arm. And so, at the very least, the health of the tissue is going to be like a plant with no sunlight. The shoulder is not going to be healthy. It's
Right.
not getting what it needs for its maintenance, which comes from the nerve. And so, Ed, I got disc injury in my neck. Okay, well, that's going to involve the health of your arm, the
Right.
strength of your arm, your ability to do gym exercises is going to be affected. So, what we do, the first phase of care is wake up all the young parts.
Okay.
And God designed our spine with a mechanical, let's just say, firing order. There's
Our same as spine.
so when we bend, not all the vertebrae bend at the same time. There's a firing order like an engine in a car, right? This piston goes, then this piston, and then there's a...
Right.
So when we turn our neck is supposed to do... The first bone that's supposed to move is our atlas.
Right.
And then the axis, and then C3, and then C4, and it goes down to the lower neck. And so essentially we shouldn't be able to wear this out without first wearing out the upper neck.
Well, I'm gonna tell you like this right now. This area right here,
Yeah.
this thing that you talk about in your video, that little,
Atlas?
yeah, that's never been right.
Right. Well, that's
That's been popping and snapping my entire life.
right. It's not, there's a dysfunction up here. There's something going on wrong that allowed this to be overworked. In the same analogous way, the L4, L5, everybody at home, what he was saying earlier, the laminectomy means they take out the back wall. They're taking out the whole back wall here to relieve. So it's like it's stuck between a rock and a hard place. Remove the rock.
Right.
So they remove the whole back wall. I treat alignment. People watch me and they go, well, what
That's
you do-
what got me when I first started seeing your video.
Yeah.
It wasn't so much. I see a lot of people that do the stuff in there, but I look for people that actually. I want to be educated as to why it happened and what I could do to prevent it from happening anymore. I don't want you to just throw me a pill and tell me, okay, this is going to feel good for 2 or 3 days.
If your middle back was working and if there was a curve in your back, a lot of this, almost all of the stress that happened down here wouldn't have progressed.
Right.
There must be, and this is where when I first hug you in a second, we're going to check the mobility of your chest. There has to be a level of non-work restriction up here that allowed this to get so injured to the point that they were removing bones.
Correct.
Right? So I expect to find some resistance, and Ed, it's not really comfortable to adjust it up here. That is your problem. And then to aim your spine back to being curved, I imagine it wants to be straight, and when it's straight all the way, like a ladder, it goes right down to the bottom. And so where you want to be and where I want you to be, you understand, are two different things.
Yes.
And so getting the weight off the disc, notice when there's a curve in the spine, the discs are not heavily pressured. What we find predominantly is that the front part of the disc, called the anterior part of the disc, is so compressed that the jelly starts to
Push
go
out
towards the back. And like I can speak to you in dental terms, the disc is like the enamel, it has no feeling.
Correct.
So you can damage the disc like that early 20 fall. I would presume that cracked the end plate, so the disc cracks where the vertebral body contacts the disc, gets cracked. None of this has any feeling. That begins the process like a cavity in a tooth going towards a nerve root. The disc liquefies and starts to have the propensity and ability to actually be herniatable and then be able to hit the nerves. And that's what, the legs and the lower back, and that's, again, the laminectomy.
Makes sense.
So let's take the stress off the lower back. We work on posture. The posture is the overarching controller of the body. The alignment that you're in that gets changed from injuries then allows us to then live our lives and then be injured, essentially. So because you kept driving to California with the bad alignment, if you hit a car if you hit a truck or hit a curb, you bend your rim, let's say, or you take the car out of alignment. That was $500 to fix.
Right.
But now because you drove in the bad alignment, you caused thousands of dollars of damage because
To other stuff.
the $500 thing could have just been fixed early, and it would have led to now my bearings are worn out, all this
Correct.
other stuff got worn out because of the alignment.
I remember the video with your dad.
Just give me a nice relaxed posture. If you can just turn this way towards me for me.
Okay.
Yep. Yeah, just relax right there. Left shoulder is markedly high.
Yes.
It's at least a half-inch higher. Your body's gonna, like I said, it's gonna try to find position of relief. Left hip is high.
Yep.
Okay. So I'm gonna exaggerate a little bit, but this is what's going on. Your head, essentially, we're gonna feel a knot on the right side of your neck. Your head went left, and then to make your eyes level, we had to drop this right shoulder. You're basically in right neck avoidance. So you have pain in your right shoulder, which is partly, so you're in avoidance of it, and it's still hurting,
Right.
which tells me it's been there a while.
Right.
That even
Because just standing here now, I can feel the pain shooting from the top down my shoulder.
you're pinching that left. That left's being pinched because you're avoiding this shoulder injury or shoulder nerve pressure that you're feeling over here. You're trying to, if your head wasn't tilted, that would be worse, is what I'm trying to say. And that,
So is that why when in my military career I always stood, whenever I stood at attention kind of thing, I always felt like I was not straight.
right.
I feel like I always had to twist a little bit or change something to be straight.
Correct. Well, part of it is you don't have the whole spine working, and then whatever parts that are able to be moved, your body's trying
Trying
to
to overcompensate.
what we call functional scoliosis, wherein if I break my right leg, I'll put more weight on my left leg.
Correct.
And now I create a scoliosis because of an injury.
Correct.
It's not really a true scoliosis, it's because I have pain, which I looked on your sheet, you had a lot of check marks. So we have pain, of course there's gonna be bones that are crooked.
Right.
The bones are crooked as a result of the pain, not as the cause of the pain. And that's a very, unfortunately, not really talked about. Everybody chiropractically believes the bone's out of alignment and that's what's causing it to hurt.
Right.
I go, no, it hurts first, and then the bone becomes crooked as a result. Exact opposite. You understand? It's the alignment shift is again, look at if I fall and I crack this right ankle, I'm gonna start shifting.
Where it's comfortable.
It's crooked, you're crooked.
Right.
That's because I'm injured. Something got injured first.
Right.
Do you understand? I wouldn't be crooked if I wasn't injured. You had a fall, things got injured, discs started hitting nerves, your body became crooked as a result, not as a cause. So therefore, the treatment of trying to directly adjust the injured areas can't work, because by adjusting them, if I sit there and manipulate the broken ankle, you're just going to keep injuring it more.
Right. This is the fun part.
This is the fun part.
This is the fun part.
Head here and then face up. Yes, sir.
You don't know how much I've been dreaming about this.
Take a deep breath in for me. We'll sit up. Take a deep breath. Let the chest relax. There you go. I got you, buddy. Yeah, deep breath in. It's okay. A little tight here. Exhale. I got you. Wow. Total rock. I got you. Breathe. Yes. All right. All right.
I tell you what, you were the first person to actually make that move in the middle like that. I'm serious. Dr. Warner does it too, but he doesn't do it all the way like you did.
I'm gonna get more than that. But all right. Your restriction in your middle back is the problem.
Ah.
You see, it's supposed to be soft in there.
Right.
Now, that's not fair. My dad's a chiropractor.
Exactly.
You understand? It's not a very fair comparison, buddy boy. I've had my dad's a dental hygienist who's been cleaning my teeth my whole life,
Right.
and you've had your teeth kind of cleaned every once in a while. You understand? And you didn't get a toothbrush. You understand? And so you might have some more dental decay than I do.
Exactly.
But it's supposed to be like a piano. I'm going to run my hand down the piano, and all the keys should just go down effortlessly.
Correct.
There you go. And then, so the goal of this adjustment the rest of your life is to never touch your lower back. Hopefully everybody's doing that. I'm going to show you exactly what I want to do. Keep your hands here. So we know we have an injury in the lower back. Nobody ever touches your lower back. I hope that's pretty well understood by everybody, especially with the laminectomy. Let's completely leave the lower back alone.
Okay.
The goal of this adjustment is, what are you trying to do here, Ed? We're trying to loosen above. I got no movement on that first tug adjustment. I have a frozen T12, L1, T10, middle back region, which then allows this to be abused.
Okay.
Because this up here
It's stuck.
when you bend, all the bending is
It's
occurring
happening
here. Breathe, I got you. That's okay. Yeah, you just, wow. It's frozen, bud. How's that? We'll get you. All right. All right, face up for me. On your back. Okay, I got you. Just this top guy a little bit. Shoulder down as best you can. I know. Good. Give that a second.
Yeah, that was beautiful.
There we go. Relax. There you go. Okay. All right. Beautiful.
He's real, people.
Okay.
He is absolutely real.
Oh yeah, there. That kind of like that jumbled marbles up here. There's just a bunch of little, whatever you want to call them, little knots up here that have.
I knew you were gonna have a great time.
There's the channel right here that goes, we call this the thoracic outlet, but it's a funnel where all the nerves that leave your lower neck go to your shoulder, and
Okay.
the
That's from all
Right.
those rucksacks and
right.
those 12, 22-mile road marches where you're
Right.
carrying about extra 90 pounds on your back.
Right, and the lower neck was eating most of it, and the upper neck was in a hammock drinking a pina colada, just
We
observing.
We thought we're such tough guys. You know, we're just tearing our minds apart.
I get it. It's so hard.
I just right now, seeing that you're doing all of this and going through all of this just to get me to function
Yes.
at the decent level,
Yes.
I'd like to apologize to all my uncles and my aunties and all those older people that told me, oh, your time's coming.
Oh.
I apologize. I understand now. We're gonna have to get your office closer. So when I went to Orlando Health, and I consulted with Dr. Service in their orthopedic, and he was excellent. He got my shoulder actually to the point where I could actually use it
Okay.
more than I did before.
I'm just going to speak generally. Obviously, I haven't seen any pictures of your shoulder. I'm just going to speak generally about the shoulder. When our shoulders round forward, because we're trying to not pinch a nerve in our neck, or
Right.
because our work is so rounded forward because our hands are forward all the time, the shoulder starts to ride on the anterior lip of that glenoid fossa, where we call that the labrum, or, and like I said, slap tears. Maybe that's usually where it gets injured, is the edge,
Right.
because there's not much cartilage even when you were young.
Right.
It's a shallow part of the water. It's not that deep. The depth is low, and so if you grind on that for very long, you're going to tear it.
Right.
And the biceps tendon actually attaches to the inside of the glenoid fossa. So there's the fossa, and the actual one of the bicep tendons attaches. So if you actually start to grind on the superior lip, you'll actually tear some muscles and tendons, and so the interaction, and then the ligaments are wrapping around that whole joint, holding everything together. So when your shoulder, for instance, goes forward, the posterior ligaments are stretched, right? When you bring your shoulder back, the anterior ligaments are stretched. And so if over time those posterior ligaments get injured or torn, now the shoulder just stays in the wrong position.
I gotcha.
So the most common thing I find with the shoulder happens is that the shoulder goes forward and down is the most common misalignment. And so the correction is then up and back.
Correct.
Do you understand? To take it to what we call the mirror image of the opposite. And we accomplish that in a minute on the end of our visit today. We'll have you stretching, and it's to work the shoulder up and back to reset the shoulder back into an area where there's the most amount of cartilage and where there's not going to be tendons and ligaments to be injured and torn. So
Understood.
in order to do that, like I said, in understanding what your work that you've been through and the commonality is that usually the pec is a domineering upper body muscle. The tighter the pec is, the more the shoulder rounds forward.
Right.
With the understanding that many times it's not just your work that pulls the shoulder forward. When your shoulder goes forward, it opens up this channel, alleviating, buying you time, meaning you would have had that symptom at 30, but your shoulder just went forward, and that bought you 10 years. Do you understand?
Gotcha.
This will be sort of the Nick Walinda balancing game that I play of trying to bring your shoulder back without hitting the things that your body went away from by putting the shoulder forward. And that will be kind of a journey, that we make. And so, but
Be a lot of journeys because
Yep.
I'm definitely coming back.
I think of it like a plant. Every plant needs three things. You need water,
Right.
fertilizer, and sunlight. And if you give a plant two of the three of those things, the plant still dies.
Yes.
Give it plenty of water and fertilizer. Oh, I have the best fertilizer. It's very expensive fertilizer. Yeah, but you stuck it in the closet. The plant's dead, right? So, or you give plant plenty of sunlight and fertilizer, but no water, and it's dead.
Understood.
Right, and so the tissue, every tendon, every ligament, every joint needs three things. It needs blood flow. Right, if I put a tourniquet on your arm, your whole arm atrophies and dies. No matter how much
Exactly.
how much nutrition you put in your body,
Right.
there's no blood flow, and so it needs blood flow. It needs nutrition in the blood that needs to go to the tissue. You need materials, And then you also need nerve flow, which is the sunlight. And it's probably the least understood component, least talked about component, is that when we pinch a nerve in our neck, the sunlight to your shoulder gets the power cord is messed with, right?
Okay.
So now you're hitting the button on the computer, and the computer's not booting up because it's not plugged in. And so the shoulder won't function properly if the power, and that's what D.D. Palmer started 1895, that nerve pressure causes disease, and it's one of the components of what needs to be addressed if we want to stop, further damage and further disease, let's call it.
Well, I tell you what, I mean, I went to school up north in the Northeast, and I tell you what, they didn't teach us enough about the body in class. I mean, some of the stuff that you're saying as I watch your videos,
Right.
oh, I doesn't know one talk about that.
I don't know. I have MDs that come in as patients, and I've spent hours with them, and I talk to them about all this stuff, and they usually don't say anything that is against what I'm saying. They usually say, Ed, everything you say makes sense. We're just not taught to think this way.
Oh,
Is the
my
most
gosh.
common answer I get.
Wow.
That they're not taught to think about it from a spinal column neurological standpoint. So he's got injured discs at L4 and L5. I ask an inverted question. Why does he not have an injured disc at T10?
Yeah, like, it's all supposed to be connected.
They're all, those discs are the same age. Your T10 disc is just as old as your L5 disc.
Right.
So don't you dare tell me that it's age. They're all the same age. It's the alignment and mobility. He was chewing excessively on that tooth because his alignment, just like the alignment of your teeth in your mouth, right? If your bite's wrong,
Yep.
you'll grind on
If it's
certain
off
teeth.
by a millimeter,
Right.
it'll drive you nuts.
You're going to wear out certain teeth at a faster rate.
Right.
But it's not the age of the teeth.
Exactly.
It's the alignment still. It's orthodontistry. They got in that whole.
Well, that's what a lot of people don't understand. Whereas some people, after they have surgery,
Mm-hmm.
they can't do certain things with their mouth, but they might have their teeth. It's just that their way their jaws come together
That's
might
right.
be
There you
different.
go. Your bite. Yeah. Mm-hmm.
Ugh, I don't remember.
Yeah.
I've seen enough of those surgeries.
Your spine reminds me of my dad's spine. It's very, broad shoulder, big thick chest. It's just easy for this model to lock down in here.
Right.
It's just, and the care should have been, at 25. Look, with this build, with this Chevy Suburban, whatever, with the this is going to lock down.
Right.
And and if this locks down, 20 years later, that's going.
Right.
You're gonna wear out that bearing at the bottom, and it's not a disease. It's just a result. I'm gonna have quiz my wife here in a second. What do you see? Make her see if she.
I see
Everybody-
his right side way elevated.
Okay, I'm not making it up.
Really rotated.
Mm-hmm.
Pretty elevated right here. Okay, and we're gonna work on it. Yeah, I can't underplay how important it is that we get as much care right here. This is. I'm gonna start getting quiet because there's a lot of pressure that we gotta bust this loose.
Oh, I'm
man.
used to it.
Gee.
I used to get all the jokes from all the surgeons in my dental field. They used to tell me all the time because I had supernumerary wisdom teeth,
Yes.
which means I had an extra set behind my wisdom teeth.
Wow. Okay.
So my surgery was, they had to put me to sleep completely. I had to literally, cut my gums open, and then they had to break my jaw open to get to the teeth. So it was like a crazy, crazy thing. I don't know what my mom and my family have been doing up there in Jamaica, whatever they're eating, but I'm tired of people telling me, oh, your jawbone is like a concrete.
Yeah, definitely would agree that your bone density is not lacking. Let's just leave it at that. I don't think you have a bone. I have way too much tightness in here. And this is your cause. This is the problem. The lower back was the result. This was the cause. This had been, this probably was already built up, and then you hit, you 7 feet, 8 feet, and then it. See, mechanically, when we're young, when we bend, this moves first. So then the first place that gets injured is here.
Right.
Because this is the first responders. These are the first people to arrive to the crash
Okay.
are these guys. And so they get injured, and then they're the first to quit. And then it leaves
Everything else.
the lower back left holding the tab, paying all the bills. There's a Geico commercial, you know, if you have alligator arms, you have trouble reaching for the check. Remember, there's an alligator sitting there at the table, right? And the alligator's like, almost there. Right?
Almost in.
Almost there. That's the middle back. He's got alligator arms. He's never paying for the check. He just not, and then leaves L5. I got it.
Yeah.
Right, so it's,
Yeah, I've been complaining about it. The doctor's been seeing it my whole career. They're like, why is your right side so elevated?
yeah, because I'm in pain. As a result, not a cause. It's
I mean, there were literal times that I was in air assault school, and literally my back got so bad that I couldn't even get up out of the bed.
yes, sir.
That side was so sore.
Well, like I said earlier, if I showed you MRIs, what I've seen thousands of MRIs is a lot of usually young vertebrae in here that are put me in, coach. You know, get me off the bench and put me in, and let's go in and try to. We have to essentially learn how to utilize your middle back, and it's not as simple as like me training and teaching you something. It has to volunteer, and it's objective. It's outside in. We have to make these joints loose enough that they actually start moving, and not just moving a little bit, but moving earlier than these guys. They have to become so loose that biomechanically they're the initiator of bending. So when you get in and out of a vehicle, when you stand up from a seated position, this vertebrae is moving the most, not where the laminectomies and above the laminectomies and all the injured areas have been. And so we redirect the traffic. Similar, like say smoking, somebody smokes for 30 years. It's not just an easy thing to
Just give up.
just give up, man. It's like, well, this thing, I've been doing this for a long time. My body's had this habit for 20, 30 years, and you think you're just going to come in and change things
Stuff
easily?
Like that.
They're not going to, old habits die hard. They're hard to change them, and I'm going to show you the way. We're going to start showing you, like the Mandalorian, this is the way.
That's my people right there.
This is the way.
This is the way.
That's right, we got to start working, and it's wow. I can't work with a piano that does the keys don't move. I got to first get the keys moving. And that's what a lot of this is, me getting WD-40 and penetrating oil and trying to free up the rust in here. This is all rusted. And I need a breaker bar. I need a blowtorch.
Something.
And I got to break these bolts loose up here. These are all bolts. They're designed to move. I'm not asking them to do something outside of what their intended function is. Like your fingers are designed to bend, but if you didn't bend your fingers for 20 years, it would hurt to bend them.
Correct.
And then, oh no, I don't like bending my fingers. They hurt to bend them. That's a really crappy way to live the rest of your life with non-bending fingers.
Like this finger here
Right. Well,
is fused.
there you go. Injury, and then your finger said, no,
I quit.
I quit. And that's me talking to your middle back saying, I'm sorry you got injured, but you can't quit. He needs you. He needs you back on his team. And then, because if we can't, then we give up. Right? If I can't get the young parts of your back working, I sorry, I can't help you, kind of idea.
Right.
Because everybody else is going to focus on the injured areas, and I can't do anything with them. They're injured. They're damaged. They're sprained. It's like if they go into a doctor with a big laceration on their skin, close the wound and leave it alone. Right? I can't heal it. Right? I can't put my hands on you and heal that wound.
Right.
They're wounds. Having a wound at L4 and L5 interacts with the sciatic nerve, and the sciatic nerve controls 75% of your leg. So you have a large territory of effect.
And I've noticed even when I'm hanging upside down on my inversion table, my left ankle will literally like make me have to sit up because it would hurt so bad.
Yeah.
I never have it with my right ankle. It's always the left.
I just caution a little bit. My worry is this, that if the middle back is so bound up and we invert you, most of the traction happens here.
Okay.
And so my desire would be that your whole spine works, and that we do it to just free up the spine a little bit. Your spine is supposed to be curved, not ortho, not
Right.
straight. And so, but symptomatically, I get it. And if I'm dying here, I need some relief, I don't mind you jumping on the inversion, but My goal would be to get to a place where you don't feel you need to do it.
Okay.
That we can achieve this with what we call extension traction, being tractioned with aiming the spine to the proper position. And we can try to interweave them a little bit. I'm not against it completely. I just want to understand what it does, and aiming it in the right direction, getting the curve back in your spine should give you longer lasting relief then, and you should be able to even achieve it with the little piece of foam. You have your knees bent and you push on your thighs, and you actually can traction yourself. I watched my dad do it my whole life. He would lay on his back with the fulcrum right here and have your knees bent, and you push on your thighs, and you can traction this open just gently to get some relief, just laying on your back. We don't have to invert, and so we can achieve some traction with extension, and I'll show you how to do that in a minute. Just busting that loose.
See that whole area there that you've been working at?
Yes, sir.
That middle section, it just feels like all the time it's tight.
Yes, sir. That's the problem.
Always tight.
We have this cage for the purpose of protecting our organs, but the downside of having the cage is that it makes the thoracic vertebrae stiffen earlier than everybody else.
See, not only am I getting relief from that spot that you are higher,
Yes.
I can feel it shooting down the top of my left arm.
Yes, sir. Yeah, that's where that's not, I don't want, if it keeps happening, let me know, but it's this channel here. We gotta open up this channel. That's why, again, the head's crooked, the shoulders are unlevel, your body's trying to find a less painful position. And
Finally, someone actually could get in here and put the pain on me like I need it to be. That's that spot.
yes, sir.
And this is supposed to be the good shoulder.
Right, right.
How do you relax?
Me, for myself?
Yeah.
I get worked on, my dad works on me, and I counter stretch myself.
Oh, okay.
Right? It's like a kitchen. It's not a matter that you did all the cooking and made a mess. It's the lack of you cleaning up at the end of the day. That was the problem. Do you understand? The
Yeah.
problem wasn't the work.
Right.
Is that you didn't clean up at the end of the day.
Yeah.
You left the mess here, and then now you got all these problems because you left the mess. Well, nobody told me to clean up. Nobody told me how to clean up.
Exactly.
Yes, there's a mess, but it's now that it's like the birds dumped on the car, but then you left it there. It was a simple problem that just wasn't taken care of. We weren't guided. We weren't guided to. Yeah, you can't leave that on your paint. Don't let this sit on your paint for too long.
Yeah.
And eat away at the clear coat, and anyway. So it's
Well, that's why stuff like this is a staple in my life now.
right. But building up lactic acid is not a problem. It's just that it needs to be flushed out at the end of the day. You can't
Right.
let it sit here and reside in the tissue overnight. And
Exactly.
most powerful joint in your body, sacroiliac joint.
Mm-hmm. I actually, the gentleman I went to, and he did a decompression thing
Yes.
where he put like around my waist and kind of pulled.
Yes, sir.
And for a long time, my tailbone was giving me issues, and
Okay.
whatever he did, it pulled it out. I've
Okay.
had that pain since.
There you go. Okay.
But my hips being unbalanced, yeah, I figured that out. Trying to do squats
Yes.
the correct way.
Yes. Gee whiz.
Heard it.
That has not moved in 20 years. 30
Probably.
Years. That has been a while.
Oh yeah, that was beautiful.
Are you okay?
Ah, that was beautiful.
That was a clunk.
That was deep.
Oh my gosh.
Yes, you don't. Yes, that's what I came for.
I think you scared him. He was like, whoa, that moved.
I'm telling you, man, this is amazing. That was what I came for.
Abidi, that's all, folks.
Yeah, I'm telling you. I told my wife, I said, hey, watch, Dr. Mac gonna find something. Watch. I promise you.
What did that feel like going?
It felt completely relief.
Clunk. That was awesome.
It was like, it just like, it's almost as if the vertebrae was stuck and you pushed it back into place. And the relief I felt was all the way up and down my spine.
Amazing.
That was like a deep clunk.
Mm-hmm.
Wow. All right. Yeah.
Mm-hmm.
Yeah, get level.
Welcome to rest. That's using the force right there.
That was
I'm laughing because Ed's face was like, whoa. I don't think he thought he was going to get
Tell you, man. I'm so used.
just roll your back again.
Is everything else in HD? I'll tell you what,
Yeah.
it's worth every penny.
You got it. Sorry, I get you. Sorry about that.
that. Face paper smushed
My
you.
favorite.
I kind of knew that was going to happen.
Okay. Yeah, this is a foot that's been through a lot. Wow. Wow.
A lot of crazy things.
Right.
Football, softball,
Right.
running 5 days a week.
Right. Okay.
jumping out of stuff we had no business jumping out of. And I have plantar fasciitis.
Yeah, I don't doubt it. There's too much weight on the toes, and when you put too much weight on the toes for this long, the toes are all jammed. That's what I'm checking right here. I'm trying to see how much mobility phalange metatarsal joint's giving me, and when there's too much weight on the toes, the arch drops. That pulls on the fascia.
And that is always painful. Sometimes every other month or so, I get that.
Try to-
in my foot.
Try to stretch the top of your foot. We want to start stretching this.
Okay.
Curling the toes. Don't go like this with the toes.
Mhm.
Start working on, without as much to the point that it might cramp, but
Mhm.
try to work on, I take the toe traction
Mhm.
and curl.
Okay.
And you see how the more this goes this way, this pulls on this and it flattens the arch.
Right.
Right, so we want to curl the toes, let this arch be in the foot, and that alleviates stress on the fabric, the fascia on the bottom of the foot.
It does.
And then ultimately we need to work up here. The tendon of this muscle supports the arch in the foot, and so again, when there's too much, when there's weight on the toes, this
That's why
muscle,
that always hurts so much.
this is contracted. You got
Right.
it. It's this muscle here.
I used to run my 2 miles in the military,
Yes, sir.
and after every 2 mile run, I thought it was shin splints at first,
Correct.
but it was just that muscle.
Yes, sir. Yep. This is what causes the plantar fascia. It's just a domino effect.
Oh man.
It's here. So working this towards the knee, right next to the shin, next to the tibia,
Mm-hmm.
right there. This will alleviate the fascia pain. Just try to massage here. You know, I want to work on the body in a way that the body accepts it, not
Right.
rejects it. I mean, like, we have to, at the end of the day, we're a team here. Your body, and if anything, it's almost like our kids. It's like I want your body to start doing what it's supposed to do, and I want it to seem like your body made it was his idea. You understand?
Right.
Like it was your idea to have this be released in
Same
here.
thing our wives been doing us for years.
Right.
Yeah.
Like,
Convince it, tell us that what it is, and all they did was repeat and rephrase what we said.
okay.
Make
Yeah.
it seem like it's our idea.
Make it seem like it's our idea. That's like the trick to the body. I have to make your body want to have a curve in it, and it be like you thought it was a good idea.
Exactly. That sucker's worse than the back.
Yep. You gotta work like there. Okay. But that's what I work on. There. All right, let me check your ear here.
This is the one I find interesting.
All right. I mean, tilt your head to the right for me a little bit. Tilt right, tilt right. Uh-huh.
Oh my
One
god.
second. Tilt right for me.
Seriously?
Yeah, I'm not adding crack sounds to the videos, right? That came from him. Yeah, I got you. Tilt left.
What in the?
Tilt your head left.
You have crunchy ears.
Wow.
It'll feel all warm and that'll helps the blood flow down here, helps these channels open up. The
Because
sinuses.
I had my first sinus infection about a month and a half ago, and I didn't know what it was, and I was blowing my nose in the shower, and it's like this paste, this thick paste just came out, and my face went numb.
Aw.
I had to go to the ER. I thought I was having a stroke.
all supposed to drain this way. So the drain lines of your sinuses ultimately drain, maxillary sinuses, all that drains towards the ear, above the ear, and then right past these channels that I just worked on. That there's adhesions here, but I also find mainly most people it's here. So they also go right down the neck, and so then all that tightness in your neck influences those drain lines, causes it to essentially back up and then come out it's like overflowing toilet. Now it's just flowing out the top.
It was not a fun experience.
Press back a little bit. Yeah, a little bit. It's good. It's good. I'm not going too crazy on your shoulders here.
No, do what you gotta do.
All right,
I came here for the rough
All
treatment.
right. Push your shoulder back for me. There you go. Yeah. Let's go that way again. Let's try.
I'm telling you, man, my shoulder is just bane of my existence
All right,
sometimes.
press back. It's all ready to get. Okay. Come over here. Over here. I want you to start practicing letting it be okay that your arms are up. Eventually, you can even have the arms. I think this is like noon, right? Like a clock. Here's noon. 11 and 1.
Okay.
10 and 2.
Okay,
9 and 3.
got it.
Right, so you're gonna work, where should I be, Ed? All of them. This is a portable thumb, a portable elbow. The intent of this den roll is to emulate my thumb or my elbow in the closest, pathetic resemblance, but it's attempting to, be an elbow or a thumb, and we use this to put pressure, simulating my elbow in your back, and it gives you some level of home care. One way when we were talking about the inversion, what you can do is you take your hands, putting some on your thighs, you're gonna grab, get the idea, and you push.
Oh yeah.
And you traction yourself. That make sense?
Yes,
about
that feels...
about 5-10 seconds.
Oh man, that felt great.
You push on your thighs, and you should be able to get close to what the inversion does, because we have the spine traction by means of. All right, so the dentaral's pushing up higher, and then the down slope is tractioning. Okay. So it's like a mountain. So the two slopes above and below where the middle point is pressuring, so it's pushing in here, and then these are down slopes. These are already tractioning. Okay. And then you take your hand and you push, and it tractions these lower segments below the dental, and that's what you can accomplish.
Okay.
Briefly doing and then exactly. You can try to. We'll take a break. Let's see if we can go a little deeper here. I got you. And then we go a little deeper. Get the idea, right?
Yes, I do.
Right.
This is absolutely wonderful.
And the idea is to.
You just come and do a little bit of this, just work your blades out.
Yep.
You stretch out, you can work on your front of your shoulders.
Yes, sir.
You come up higher.
Yep.
Do the complete rotation.
Good.
Oh, yeah.
Has anyone shown you you've never seen a dinner roll besides the
No, I've never done this before.
Okay.
I've probably done it sitting on the floor trying to actually doing it where I put my shoulder blades back and actually use my shoulder blades the way they're supposed to be used. It's been about a good couple years since I've been able to lay my shoulder out like this and twist without pain. I've never been able to do that without pain. If I rotate my shoulders back like this shoulder would literally okay, you've had enough. I have never been able to do that. Awesome. This is the first time I've been able to turn on this
today,
shoulder.
You mean?
Yeah.
Oh, yeah.
I've been able to do this today. I mean, I've been going to the chiropractor, and every time they tell me to just try and turn, I get to here, and I can feel it. But now, if I lay it down, I can actually roll over onto my thumb, and I can feel the stretching.
Yes, sir.
Instead of just pain.
Right.
I can feel stretching. So
Amen.
Appreciate that.
Awesome. That's great to hear.
I feel like I needed this.
Well, you did amazing.
I'm getting, my son is he has his own YouTube page.
That's awesome.
PLD TV.
Okay.
He's probably going to be going there and be like, okay, we've decided. We found it. You've been awesome, man. I actually got more than I expected.
Good.
So, appreciate
you took it. You took it great. Thank you.
I started in 2015. One day I just was really sick. Not long after I had my youngest child.
Okay.
And I always experienced very bad migraines and back pain, but I just blamed it on work, And then I just got really sick. He took me to the doctor. They said I was fine, and I just never got better from then. So now I'm told it's like an autoimmune thing, so I'm not seeing a rheumatologist until December 11th.
When you say numbness, do you have currently numbness anywhere?
Right now, since my feet are not touching the ground, from my knees down, I'm already numb.
Is this
As soon as I sit down.
just even to any touch?
I can feel you.
But it feels just kind of tingly, or how do you describe it?
Not exactly tingly, just
Feels
like
heavy?
numb. Yeah.
Okay, gotcha. All right, and how long has that been going on?
At least 2 years, at least, for the numbness and the tingling. At least 2-3 years, I'd
See,
say.
the spinal nerves, when they come out from the side, one branch goes to your muscles and your skin, and then another branch goes to your organs. Mm-hmm. So when you get pressure or inflammation of the nerves that leave your spinal column, you'll not only have numbness or sensation problems or weakness or muscle issues, you're also going to have organ dysfunction, because all of your organs don't have any intelligence on their own.
Right.
Your stomach doesn't decide to digest food on its own. The the brain does, and it sends the signals down through your back to your organs. So one thing that I'm curious, and with the smoking, what that does is it puts inflammation in the tissue. Your muscles process nicotine. So part of soreness when I rub your back in a minute, part of that isn't postural, part of it's chemical. And hey, I'm not just
I
letting
need
you
to
know.
quit.
Well, that's okay. I'm just letting you know what it is: depressed, or insomnia, or having trouble sleeping, or chemical irritation, or mechanical compression. All these things finally make a nerve reach a point where now, hey, not enough signals getting reached by the organ, and you have gastric paresis, or even with the hormone productions. You understand? I would argue that some of that's the ability of your brain to talk to your body. So I want to start with just seeing how your body responds to having your spine cleaned.
Okay.
Meaning going through and rubbing and assessing, do all your spinal joints work as a team? I'm not a therapist. I don't treat symptoms, I treat posture.
Right.
I believe that your spinal health is your health.
It is.
And that getting that health of your spine improved, you're going to be healthy.
I agree with that.
I just see so much on your paperwork, and I go, it's all the
There.
organ. Well, the organ stuff is all subservient to the spinal.
No, Jenny, do you hear that?
Oh.
There you go.
That's my nurse
Yeah.
practitioner who told me that my back had nothing to do with my stomach.
No.
Whenever I
Right.
told her that she was wrong.
Well, we call it, I have many patients with gastric paresis. The nerves, they call it the sympathetic nerves, the nerves that essentially shut down your stomach. When you're in fight or flight mode, you don't need to be digesting your hamburger. So your
Right.
stomach shuts down.
I was in fight or flight mode for about 7
Yes.
years, and it was like a big ball of fear
Correct.
and anxiety. And then when my cupping therapist said, "Don't be afraid of the pain, lean into the pain, not
Yes.
away from the pain," because I was always in the fetal position, and then she's like, "You got to lean into the pain." And he got in. We have like a jacuzzi tub. He got in the jacuzzi tub with me and lifted up she lifts up my back right here,
Yes.
so that I could take the pressure. And then she shows me where my spine. She tells me to lean back to where my spine's supposed to be. So I lean my head all the way back, and since we were in the tub, the weight of the water was holding my head up. There was no pressure
Yes.
on my neck. And all of a sudden, it was almost like a spiritual thing. It was so beautiful. Like the pain just completely went away. And oh my gosh, I don't even know.
No, you're fine. You're fine.
It's crazy.
So, right, we want to get all the spinal joints working as a team, and then aiming your spine back to having the curves in it. The curves alleviate nerve pressure, and it's at least one piece of the puzzle. Yes, there's a chemical component. I love coffee. Coffee's the same.
Me too.
Nicotine and caffeine are in the same category. Why does the coffee bean plant have caffeine in it? Well, it uses it as a bug repellent, kills little bugs that would eat the plant. Same thing with nicotine. Why does the plant have nicotine in it? Because the plant doesn't want to be rolled up in smoke. It doesn't protect itself. You understand? So it uses a bug repellent. At its core, what is it? Well, it's a poison. You understand?
Right.
But it can affect your nervous system. It can block pain. It fills receptors. So my point is, I want people to understand what things are. So the muscle tissue is going to be sore. It's just something that comes with smoking, or people that drink a pot of coffee. Same thing. It's the same. It'll produce itself as a soreness in your tissue. When you turn your neck around, or just move your neck up or down, is there pain when you move your neck around?
Yeah, I've, like right here, like it makes like
So looking up at the ceiling causes your upper neck to hurt.
it causes my upper neck right here, like where my neck meets. So basically, it's like my head is heavy and like very heavy, and sometimes I can't like even hold it up. Like,
Feels weak.
Yeah, it's very weak, and I have to just lay down. But there's nothing else I can do but lay down.
Yeah, you got the.
What is it? Can you explain why there's a dent? Like I know it's scoliosis, curve, whatever. Can you explain why there's like a?
Well, you have the vertebrae going over to the left here a little bit, and then
Okay.
they're also rotated. So there's a rotation of the vertebrae at the same time that there's the vertebrae are going to the side. Take a deep breath in, and then let all the air out. It's okay. Let it go. I got you. Easy, easy. All right, deep breath in.
I'm
It's okay.
sorry.
You're fine.
My
you're
fault.
fine. No, it's not your fault. Exhale. We're just going gentle. Exhale. There you go. Deep breath in. Here we go. One more. Exhale for me. Head back. Let it go. Exhale. Beautiful. Stay right there. You did good. Yeah. We got him. All right. Take a deep breath in. We're just going to exhale and twist. We're going to go gentle here. I got you. You're not going to fall. I promise. You just breathe. I got you. Good. Breathe. Relax. There you go. Good. I got you. I know. Breathe. Exhale.
This is not a good question for me.
You did good. Other side. Exhale for me. Exhale. Couple there. Here we go. Exhale. I'm learning you. Exhale. Beautiful. You did good. You did good. Yeah. On your back for me. Get this.
They said I don't get nutrition from food and all types of things.
Well, when your stomach is inflamed, you're not absorbing stuff.
I
Right?
guess really bad.
Yeah, your body's ability to get and extract,
Doesn't work.
when you're in a fight or flight mode, your body's not gonna.
Yeah.
Oh, real gentle. Here we go.
Oh, I needed that. Oh God, I was so ready for
Relax you. Yeah,
that.
you did good.
Jesus, that was good. Like I have a cup, like we have the cup. You might see a mark on my
I
face.
do, yeah.
That was on the way here. Yeah, I have the squishy ones.
Yeah.
I was just like sticking. I
figured as much.
This hurts. I bought these things where you put it in your teeth and make your jaw, and I can't get my jaw to like, I don't know.
Well, the jaw and your neck shoulder alignment are connected, meaning that when you lose the curve in your neck, your jaw is going to be inflamed. I believe a lot of just getting your head back here. Here you go, I'll show you. Your neck has to be curved. And the more arch we bring back to your neck, the happier your jaw is going to become.
Right. See, I try to like.
Yeah, I got you. You're fine. Just relax now, relax. We want to mold the spine back into the right position. It's not an active muscle.
Like pushing it.
Well, it's not active muscle. It's passive stretching. We have to kind of put you here and let you fall asleep. You know, it's time in the right position, and then your body will want to retain and be there. But when you're stressed out, when you're in pain, we're gonna, everything falls apart. You gotta
It's like
deal with
everything.
You can't.
I have kids.
They all compound. How old are your kids?
10 and 7.
Oh. Yeah, he's got.
Whenever I got my cuffing set, my son, he came in there and he's like, "Mom, what is this?" Before I opened it, and I was about to tell him, and he said, "Oh, this is your cupping." And I said, "How did you know what that was?" And he said, because I watched some videos on how to do it so I can help you. And so my kids are very active in like helping me. Like he could be like doing gua sha on one arm, my daughter will go do it on this arm, and she's 7 and she actually pulls stuff off. I'm like, whoa.
So you want to get care, adjustments, massage to make your spine supple, and then we have to start aiming your spine back to that curved position for the health of your neck and your jaw and your shoulders and your back. So there's a foam device that emulates my thumb and holds you in this curved position, and that's going to be your home care, and it's going to be like a toothbrush that you can use at home to take care of your spine. Oh, wait, I think we got them on this side. Okay, good. Okay, I got you. Yeah, right there. Wow. You got to push these attachments back.
I feel so good. Oh.
These are just attachments. These are just the cables that push all these down.
Yeah, my headaches literally surround my head.
No, there's
And
plenty
you can
of
literally like touch my head and like feel it throbbing when it does it.
plenty of inflammation in there to explain it.
This ear always feels like there's something wrong with it, like
Feels
the
clogged,
inside.
probably.
Yes,
Yeah,
very
I
badly.
know.
And they said there's nothing wrong with it. But
It's your neck that's what's wrong with it. The neck is the drain lines.
right, like they said, I'm like your lymphatic system's like your chest. I learned that from you.
That's from your neck.
And
You got it.
and like so basically mine doesn't. They said like mine
It's
don't
not gonna.
work,
It's
but I
not
don't.
gonna
I
flow
don't.
properly.
Yeah, but I just don't believe because like they say there's like no cure for this or that. I just don't.
No
believe
cure that they can do.
Right, that they can do. Like I just don't believe that. I refuse to believe that I cannot get better.
As your spine becomes healthier, you become healthier. You understand that these. I don't believe that anything that you put on that form doesn't have to do with your spinal
Me neither.
health, along with, like I said, there's a chemical component, and then the stress and the mind and worries, and so if we tackle each of those components, you're going to become healthier. And I'm just a guide. I'm like a Sherpa to Mount Everest. I'm here just to. I can't pick you up and put you on my shoulders and climb Mount Everest to you on my back, but I can guide you.
Right.
We're going this way. We're going this direction. We're going to get to the summit, and it's a climb, but we're going to make a journey together.
Something from like over here comes like over here, and
Yeah.
then I fall, and I'm like and then I have to literally it's painful, and I have to like extend it, and then it pops. You can actually hear it
It's called
pop.
the fibular head. Yeah, you have 2 bones in your lower leg. On your back for me. I'll check it. Have you busted your knee
Never.
before? You never.
I just always worked a lot, but now it's like, I don't. Like we own a business, like I don't do a lot. He does like I mean stuff and.
Right here is the the end of your fibula, and there's a joint here that it's going out of place or getting inflamed. There's ligaments that are holding that where it's supposed to be, and it's when you're straightening your leg, you're resetting the position of it. But
Yeah, I have to like literally
Something's-
pop. It literally pops back.
I understand. It just means that the ligaments that are supposed to hold that in place have either been stretched or torn or damaged, and are not. Their elasticity has become too loose and not doing their job of holding the bone in place. it's a tough one. I would encourage you to
I wear a knee.
stretch your knee, which I'll
Okay.
show you in a second, about how to get the knee in a better alignment, okay?
My foot feels like it's going numb, but but my knee feels. Oh, you're twisted, kind of. Okay, yeah, that doesn't feel good.
You okay?
I don't
Well,
like.
we gotta work on this.
I don't like the feeling.
Well, I'm saying we have to work on this. They do this, they actually do both. They call it, I think it's called fixed firm. They actually do both knees. Do you understand?
Oh yeah.
Not, they do both at the same time.
Oh.
Get the idea? And then you coming back down onto your elbows.
Oh gosh, my upper back. And my lower back.
This is how you reset the knee. This is what I would use at home to bring your knee back into the home position. And the more you master this position, the less likely your knee will pop out of position. I think that if this is difficult, if you're saying to me that this doesn't feel good,
It doesn't feel. It's not like comfortable. I wouldn't just. But it's not like something I can't do. I literally, like, even in the car, I have a thing that I put right there, and I feel like something like a dent now. I used to not, it wasn't there before.
yeah, you're hypermobile down there. What's happened is this area is getting inflamed from
gosh.
hypermobility. It's dented because that's where all the folding's happening. All the bending's happening here.
I was trying to help
And-
it.
Well, we gotta help it by moving stress off.
Oh.
Right? It's not, you can't help
Just
an
make it
overworked.
go.
You can't help an overworked area by overworking it more. It's already,
Oh, okay.
all right, it's okay. Yeah, it's just, we gotta be careful.
Oh, well, I made it a matter.
It's okay, it's okay. I'm gonna,
Because there was no dent at all there.
yeah, we gotta take the stress off there. We're gonna redirect the stress.
Does my head need to be like
Whatever's
straight?
comfortable. Ideally, letting your chin
Like
go up.
this.
If you can let your chin go up a little bit.
That's better.
If it's too uncomfortable, you can put your chin down a little bit, but
But it's supposed to be better, right? Because
Yes,
my,
ma'am.
my neck is supposed to be curved.
curved.
Correct.
Just trying to aim your spine that direction, understanding that you're gonna feel more. If it's too uncomfortable, tuck your chin, but
I'm tough, I swear.
you're doing great.
You are tough. You're a mom.
That's right.
All right, if I'm going too hard, please let me know. I'm gonna keep going deeper. Here we go.
I can handle a lot.
All right, here we go. I got you. Right there.
Yeah. Oh my god. It's like I feel it everywhere. You feel it?
I do.
What is it?
Well, I just feel all this is in the wrong place.
Okay.
It's all
Do you feel like little knots or something?
right. So
Or
because
like tight muscles?
because the bones aren't in the right place, the muscles are going to be tight, holding the bones in the wrong place. Right? So this is where the goal of today is to get you loose, and then we're going to start aiming you back to the right position. When we're in the ideal position, there isn't tightness. Tightness happens because of either guarding or posture. Right? So we take posture out of the equation by laying you down. Right now, some of this is injury guarding, that your body's tight because it's trying to protect something that's happened in here. It can be from being pregnant. You know, when
That's
when
what
rib
exactly.
cage-
That's exactly what my pelvic therapist said. She said just from carrying
Yeah,
children.
no, your ribs
I
are
weighed
transformed.
almost. I gained. I had my son when I was 18, but my natural weight's 118, and I weighed almost 200 pounds when I
Yeah.
had my son.
So what I'm saying is your body transformed. Your ribs all had to
Yep.
space
And-
open into a different position.
My daughter, she's 7. She'll be 8 in December, and she came 2 months early.
Doing great.
If you ever need a tissue or anything, just let me know. I can hand you a tissue.
Yeah, thank you.
Yeah, I can tell you've done cupping. You've gotten a lot of the surface stuff out of here.
Yeah.
You're really ready for stretching. You're really ready for the
Yeah,
morning.
like I was. We do it. I mean, I've done it a lot. Like we started with the cupping, and then I don't know. I really love the gua sha, so like every time he can, I'm like, please, babe, just do it. Oh gosh, he's getting it out up there. No, can't.
Let's get it.
He can't really get right. So okay, whenever somebody has never felt like pain, you know, right, in there, they don't really know where to go or what to do.
Yes.
And so that's his problem. I'm just messing with him.
He's too
He knows I'm
pain-free.
kidding. He knows I'm kidding. But really, you know what I mean.
It's hard working on your lover, okay?
It's so tight though. It feels so tight.
Mm-hmm.
Oh gosh.
Mm-hmm. Come on. Mm-hmm. Come on. I know. All right. Take a deep breath in. Just relax your shoulders, relax your back. Breathe for me. Breathe. We're gonna stretch. Breathe. Exhale. There you go. Breathe. There we go. A little bit moved. Breathe. I need you to relax. Relax though. Relax your back. Take a deep breath in. I got you. Exhale. There you go. Relax. There you go. Good girl. I know. A little bit more. I know. You're doing good. Breathe. Breathe. Exhale. Come on. Good. Okay. Good. Arms down for me.
I'm not afraid. I don't know why I'm not.
You're okay. It's a new adjustment. Put
Okay,
your arms
yeah,
down
I've
for
never
me.
had any of
It's
that
okay.
done.
Arms right there for me. Breathe. I got you. We're stretching. Exhale. Breathe. 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 Hold. Good. Good. All right, breathe for me. Breathe. Good.
Oh God.
I know. There we go. All right, good. I got you. It's okay. I know.
Like as soon as he started to lift my legs up, I could immediately feel it in my lower, like my midfoot.
Right here. Right.
Oh yeah, it's very bad. Whew. Jesus.
If you need a break, let me know.
Oh no, I'm good. I'm dramatic. It's very like sore, tender, and. Not as bad over there. I say that until he starts digging in.
Careful. Right there, yeah.
Oh yeah, that's very like I feel it all the way in my whole right side. It's like a softball in there or something. What the heck is that crap? Is that your freaking elbow?
It's his thumb.
Your thumb? God, that's a really strong thumb. Jesus. I really thought you were using your elbow the whole
I
time.
know, it's okay.
What the heck is wrong?
Iron thumbs.
Oh, man. Every time he's tried to do this spot, I won't let him. I don't know what it is about I don't know what it is about them. I cannot handle it. I'm gonna pretend for YouTube that this I'm cool right now. I really do.
I feel it. It's pretty bad.
My foot hurts so bad right now. It's like cramped up right here.
Aw.
Oh my gosh! Please fix it. Please fix it. Like my feet hurt so bad.
So the calf
Yeah, it's like my
cause your yeah.
Oh, what is it? What happens?
Gosh, this is all nerve hypersensitivity.
It's so bad. It's very bad. I swear I'm tough. I swear.
No, when you get a cramp like that, it takes down the temperature.
I'm like, fix that.
Is it better now?
Yes.
Okay.
Yes, he fixed it really quick. Just couldn't. I don't know.
I wouldn't gua sha. I don't think you need gua sha. I just try to get some blood flow down here. I don't think this is not a circulatory problem anyway.
Okay.
This is fixed by her glutes and her lower. Her
Oh,
lower
really?
back. Yes. Yeah, this
Well,
the
why is it so
neurological-
painful whenever he tries to wash on it?
Well, the health of the tissue is dependent on the nerve in your back being healthy.
Oh.
Right, so because the nerve in the back isn't healthy, then everything that nerve controls isn't going to be healthy. Right, so the nerve supplies the power. Just like if there's no circulation, the whole area would fall apart, it would atrophy. In the same way, when the nerves, we call it neurological atrophy. So then you have weakness, damage, inflammation starts to accrue and build up in the leg.
Yeah. Can never get a big toast.
Okay, yeah. Already.
Oh, I'm so ready for this.
All right, I got you. Tilt your head left for me.
Left.
I got you. Go ahead and tilt your head to the left. Tilt left. Okay, good. Okay. Tilt right. Go ahead and tilt to the right. Up in there. Okay. And have your back on your back for me. Relax your leg. I got you. I got you.
Oh my god.
Good. Very good. Let's see if there's anything in here. It moved. Just move there. Okay, good. All right. Turn over here a little bit. And have you press back with your elbow into my elbow. Press back. Okay.
Wait, like this?
Okay. You got it. It moved.
I did.
Put your hand around your hip for me. Press back with your elbow. There you go.
Oh, can we do that again?
She's like, I get it now.
I gotta
Press
be.
back. There you go. Yeah.
Oh yeah, let's do it again.
You think that was more?
I mean, I don't know how many times I need it done. You're pretty
Press back,
far
press
away,
back,
man.
Press back. Press back. I think we got it.
We got it. Okay.
This brings your spine back to where it belongs. Brings your neck back to home, which is that.
Just this part.
Yeah. Just simple as falling asleep and doing 20 minutes on the stretch. It's gonna feel odd. The back of your neck might go warm or tingly after, especially the longer you spend on this. It's gonna feel odd. The goal is to have it kind of middle upper neck. I don't want it down in your lower neck where it's
Okay.
really loose. I want it kind of targeting your middle upper, but I don't want it so high that your chin is down. So I want your head going over the device.
Something similar to this is what I was putting on my lower back.
Yeah, just not in the lower back. We want to do it more than middle back.
Okay.
So your lower back is overstressed, and I want to be careful to be not putting more stress on the already hypermobile area. And what's difficult chiropractically is that it's easy to adjust the parts of your spine that are loose. It's difficult to adjust the parts that are stiff, right? So what happens is chiropractors can get in habits of popping the parts that are already loose. Do you understand?
Yes, like
That-
he didn't roll me back, and I don't remember.
You're pretty stiff in your back. I'm saying your upper back was stiff, and so that's why I lifted your legs up and I'm pushing on your chest. You understand? We're arching you back into extension when I'm adjusting you, and so the idea would be then to lay back, arch back, and stretch, and then we adjust it again, and they both work together in progressing you to being back upright, and then all that soft tissue cleaning will not be as necessary when your alignment's better. My first checkpoint is 20-minute stretches. That's the first thing I want you accomplishing. And I did it for 5 times for 3 minutes. I don't like it. That's not what I said. I said 20-minute stretches, okay? You have to, I want that under your belt. I expect it to be uncomfortable where the roller's pressing in, okay? That's not a contraindication. If it hurts where the roller's pressing, hang in there.
It's
If it feels-
lower.
Try to move the knees to the right, move the knees to the right, see if you can stretch it out. There you go.
Dang, that my lower back is all.
Lower back's hurting. Yeah, you're so loose down there that even when we're putting pressure on her middle back, her lower back is so eager to move. So you really need more adjustments, soft tissue care to be able to get to a point where you can do things like this safely. But doing this makes your need to be adjusted less. The idea is that it is uncomfortable where it's pressing in.
Yeah, that's where it feels
You need to start tackling it. Stretching is how posture's changed.
So if I just go back to my other chiropractor and just get normal adjustments?
You need that hung adjustment, if I can, or that's the best way. That's to me we're gonna do it again in a second. I'm gonna adjust you one more time before I let you go. I want to adjust you, stretch you, adjust you, stretch you. It's like you got to keep going. It's like a bolt. You got to try to move it, get some penetrating oil, then you work the bolt. It's like you blowtorch it, and these are joints. They're just knuckles. And it'd be like me asking you to bend your finger, and you're going, "That's pretty good."
Yeah.
No, it's not. That's not pretty good at all. Yep, perfect. Take a deep breath in for me. Here we go. Got you all loosened up, and now, see, head back for me. Head back. Try to put your head on the head. There you go. There you go. There you go. Head back for me. Much better. Head back. Exhale. Come on. Let it go. I got you. Wow. Exhale. Chin down. Chin down. All right, good. Yeah, we got them all. Wow. Yeah. Do you understand what those joints have
They
not
haven't been able to
moving
move. They haven't been able to move.
I'm sorry. That's tough. That's tough having it that tight for that long. It's okay. That's been
A
tough.
long time.
Yeah. We'll get it.
You did.
You did great.
It's just everywhere.
Yeah. You gotta. But we can maintain that by the stretching. You understand? And then every visit will get easier and easier. It took an hour to get that to move. That's tough. That's tough.
Side.
Yeah.
Do you want a moment or?
You okay?
Okay.
Breathe.
It's a good thing.
Good.
It's okay.
Good.
Breathe. You
Yeah.
did great. That was deep. That shocked me. I didn't think it was.
I've
gonna
never
move.
been able to get somebody I always
That was-
beg people to try to
You did
even
great.
when they pick they pick you up I even told my dad to do it nobody's been able to get it.
That's the deepest I think.
Everybody's always trying. They just if nothing, it's a little tiny pop of if anything.
That's all prep, though. You understand? But it shouldn't. My point is, it shouldn't take an hour to get your joints to move. They should be moving an hour ago. You understand? And that means that if it takes that much work to get them moving, then they haven't been working for you. It's okay. So it'll get easier and easier to have your whole team working for you.
Nobody understands.
I get you. You did good. You did great. And then every time from here on out, it won't be as difficult to get it moving. You understand? We've done the groundwork.
Right.
Right? So when you get adjusted again, and every subsequent time I adjust people, the difficult, it's like the first time you get the bolt to turn is the hardest. But then you tighten it again,
Right.
and then it moves easier. You understand? It's that break in that first time, that adhesion in there is the hardest thing. It's because it hasn't moved for a while. It's think of them like bolts. They're just bolts that get rusted. And what is rust? What is Loctite? It's just they're glue that gets formed inside that in the threads, and then it gets bound up. Old bolts. Not that you're old, but my point is, they do.
Well, that's a long. I'm 28 for it to
No,
be
you're young. You're young.
so bad.
Super young.
For it to be so bad, it's the pain. I could feel it everywhere.
I understand. All right. Let's see if I can give you some more here. I got anything left? I got you. this side out a little bit more. There you go. Relax this side. Relax here. There you go. Yeah.
Thank God.
Yeah.
I'm more relaxed now.
You did great. No, that's what I'm saying. It's part of it is a dance. We have to dance together, and your spine has to like know that I'm not gonna
Heard it.
hurt it and step on your toes. I'm never gonna dance again. You know, somebody stepped on your toes once, and so it's like scared. Let it go. I got you. I think we got them all. Just checking. Wow.
Oh yeah, that was good. I've never had anybody crack me like that. I've never had anybody get big ones like that out of there.
That was good. Look at
Because
that.
I'm constantly always like,
No.
I'm always trying.
I've worked it all out of there.
Oh, yay.
Good job. You did great.
Thank you so much.
No, thank you. Come on up. You
Okay.
did great. I got you. Easy,
Feel.
easy,
Make
easy.
sure there's nothing else.
You did great. Oh,
Thank you so
All right, you did great.
much.
Thank you.
Really well.
Thank you guys so much.
Awesome.